Janice, just how fast is the virus spreading in Africa?
It's spreading pretty fast. I mean, the area that's, for lack of a better word, the epicenter, which is eastern Congo, is a particularly tricky area to be working in. There are a lot of small-scale miners in the area, and there are also 4.2 million or so displaced people from years of internal conflict. And a lot of the people in these camps are children who are malnourished, and people with other infections or comorbidities. So working in that area is particularly tricky, and the surveillance of the data of which strain is spreading and how fast it's spreading is not that easy to come by.
You mentioned surveillance. We know that it's surveillance, education, vaccination in response to a deadly virus like this. The world's been through it before. Is there enough financing available to get all that done?
Not quite yet. The emergency response that both the Africa CDC and the WHO called last week, certainly part of the reason for calling that was to start releasing funds. Both the Africa CDC and the WHO did find funds through other mechanisms, emergency mechanisms that they've got, and they've released some of that. More is expected in coming days, but they certainly need the support of the international community. They need donors, and they're working very hard to do that. The vaccines will come, hopefully quite soon, in the first batch, but getting those shots into arms is not a simple process, and it's something that you want to do before someone is infected. So there are other measures that are also in place, therapeutics, and that hopefully will start moving quite quickly now.
And we've also seen this particular strain of Mpox showing up in Sweden and Pakistan and the Philippines. I wonder whether the health authorities are expecting it to spread further.
I think they are, and they're trying to remain calm and not cause undue alarm. But the truth is that borders don't respect an infectious disease. These things will move. And so surveillance is certainly being increased specifically from people coming in from that region. As long as someone's, presenting when they get back to their home country and being tracked quite carefully, there should be some level of containment. And we know that this disease primarily spreads through close contact, sexual and otherwise. So, isolating, just being a bit careful will go a long way.